Okay, another key thing we can do to this pregnant woman with sickle cell is to manage or encourage hydration and oxygenation. These are very key factors. Hydration. Adequate hydration is very crucial to prevent sickle cell crisis, which can be precipitated by dehydration. As you know, blood contains around 90% of water. So the more the blood is viscous, then it means it can freely move through the minute blood vessels. So this woman is encouraged to take a lot of water. At the same time, oxygenation, hypoxia should be avoided, and supplemental oxygen may be needed if there are signs of mental, respiratory distress, or fetal compromise. When we talk of oxygenation, we are talking of a sickle cell person who is living normally. This person can be advised to prevent situations of hypoxia. For example, when somebody is a swimmer and is diving in water, there is that period when she's closing off the nose and mouth and not breathing at a certain period of time before this person dives out of water. So that can be a period of hypoxia. And those few minutes a person can dive in water can cause a crisis because there is increased hypoxia during that very time. And things like being in smoky areas, being in non-ventilated rooms, which reduce any condition which reduce the supply of oxygen, may be one of the causes of a sickle cell crisis that is due to hypoxia. So as we talk to these mothers, let us talk to them to avoid or to improve on their oxygenation environment such that they may not get any crisis or even to compromise the fetus. Then next, these mothers, always, or patients, I'll call them patients, they usually go into pain, like you have seen in the pathophysiology, that the sickle cell always block the blood vessels. And as they block the blood vessels, these people will complain of pain. So sickle cell crisis can still occur during pregnancy, often causing severe pain. So if the mother presents with pain, should be managed very well. For example, with acetaminophen, if she's complaining of mild pain. We can move into opioids for severe pain, although should be carefully monitored to avoid dependency. We shall also avoid NSAIDs during the third trimester due to the risk of premature closure of the fetal ductus arteriosus. Things like aspirin is an anticoagulant, so it may enhance even bleeding. So when they reach around the third trimester, we avoid the NSAIDs and then the aspirin to prevent other complications. Then at one time above, we had said that they are very prone to infection, so we should be cautious at infection prevention. And these women who are prone to infections, particularly UTI and other respiratory infections. So with them, we can be able to give prophylactic antibiotics, for example, penicillin, which reduces the risk of pneumococcal sepsis. We can also encourage vaccination, up-to-date vaccinations. For example, in the period of COVID, we could improve on every patient with COVID in order to improve on the infection, prevention, and control. Then screening for prompt treatment for any infections that may occur during pregnancy. This person is prone to being very anemic, so Prophylactic transfusions can be done. These are often due to reduce the hemoglobin S percentage and improve on oxygen carrying capacity, reducing the likelihood of sickle cell crisis and other complications. Then there is transfusing a patient with packed cells under diuretic cover if HB is below the state or below 5 grams. We are saying that transfuse with packed red blood cells. Why not whole blood? Because this person is not losing a drastic volume of blood, but her blood, because he's a female, her blood is being hemolyzed. The red blood cells are being broken down, but we have no problem with the volume. That is why we would like to replace only the red blood cell, and that is called the packed cells. We can go ahead even to carry out the exchange blood transfusion, which may be considered in severe cases, especially in the presence of complications like acute chest syndrome, stroke, or anemia, etc. Then we shall have folic acid supplementation. This person, we are not going to give ferrous sulfate. Why? Because she's having iron, which is constantly broken down. So for cell build-up, we shall use folic acid. Due to increased blood cell turnover, women with sickle cell anemia should receive a high dose of folic acid, 5 milligrams, especially every day, to support the red cell production and prevent folate deficiency anemia. We can also look at management of the presenting complaints, that is eclampsia, venous thrombolism, acute chest syndrome. So preeclampsia comes in as there is severe constriction of the blood vessels, thromboembolism when there is a clot or a thrombi, which is in peripheral vessels. Then we have talked of acute chest syndrome. It can also occur, and hospitalize the patient whenever complications may develop.